Hi, I'm Dr. Ian Horseman from the Brain Therapy Clinic, and today I just want to talk to you about something that I commonly see on x-rays as a result of a car accident. The problem with car accidents is they happen so quick that the body has no way of tensing up and resisting the injury. And what happens when the forces go into the spine, often you'll see damage in the ligaments. And ligaments are like steel, and unfortunately, once they get strained and pulled, it's permanent damage. Now, the insurance companies don't want to talk about that, but we know that that's true. And I want to show you two things that commonly we see. This was a patient who just came in last week, and I just want to show you her x-rays and show you exactly what we're seeing. This is one of the common x-ray findings that we see, and it's often missed by a lot of clinics. It's called alar ligament tear. And what happens is the C2, the vertebrae here, there's a little triangle there. And what's happened is it's actually rotating over to the right because the ligament that comes off of this vertebrae into the back of your head, so even though we're looking at it from the front, this is the mouth here, you'll see that it's actually shifted over this way. And that's because this ligament, that steel, has been torn and the vertebrae is allowed to rotate over. If the differential is more than 3.5, it's a complete tear. And the person will have dizziness, headaches, nausea, sleep issues, and a whole bunch of issues. And we have wonderful ways of helping to fix that. So if your doctor's not aware of this, make sure you get to a clinic that understands about alar ligament tear. So this is another finding that we see very commonly in x-ray to various degrees. But what you can see here is normally you should see a nice cervical curve here. And the curve itself should measure about 40 degrees for most patients. And what you're seeing here is you can see that the spine's actually gone very straight, and actually it's starting to mildly go backwards this way, or kyphotic. So lordotic meaning forward, kyphotic meaning backwards. When you see it going backwards, we know again that the ligament tear is happening right at this segment here, because you can see these vertebrae are no longer participating. You can actually get the person to fully flex and extend their head, so bringing their nose down to their chest and their head as far back as they can, and you can actually measure that shift. And if it's more than 3.5 millimeters, that means there's ligament tear, instability, and it's a nightmare, and it's a lifetime of permanent problems, creating things like nausea, dizziness, swallowing issues, jaw issues, headaches, problems in the shoulders and down the arms. A whole bunch of issues. At the posture clinic, we actually know how to fix this and restore the person to as much normality as possible.